I am so very pleased and honored to be sharing this platform with Dr. James P. Comer, who has informed and transformed educational practice nationally and internationally. For 50 years, Dr. Comer has led and inspired child-centered approaches to school reform. Dr. Comer has mentored, supported, and inspired dozens of educators, including classroom teachers, educational leaders, policymakers, and students themselves to be their very best selves. The impact of Dr. Comer's work cannot be overstated. For half a century, now just think about that, half a century, Dr. Comer has worked untiringly to make our schools, our school districts, our families, and our communities, our schools of education, crucibles of developmental understanding and support for all children. So this morning I have the very distinct pleasure and honor of having a conversation with my mentor, Dr. Comer, about his life's work, focusing very broadly but with some specificity on what I have chosen to call critical events and milestones with the school development program. So my first question, Dr. Comer, has to do with reflecting on three of your very important works: School Power, Waiting for a Miracle, and Maggie's American Dream. I want to begin by asking you to reflect on these publications in which you focus our attention on the capacities and power of schools to make a difference, in which you articulate the power of parental involvement and parental inspiration as exemplified by Maggie, your wonderful mom. And the third volume, Waiting for a Miracle, in which you talk about the fact that schools cannot go this alone, but we need the support of all of us, policymakers, government, local and state and federal, to help bring about the change that we need. So Dr. Comer, would you kindly share with us, each of us, all of us, the inspiration that inspired you to prepare these three volumes? And what are the central messages that you would like us to remember and think about that you so very aptly described in these three volumes that you blessed us with?
Well, thank you first. Thank you very much, Dr. Haynes. And thank you all for being here, and thank you all for your work that made my ideas, concerns, wishes possible, and the kind of template you have provided for addressing the needs of all children in this country. I think the work that we did started, and I'd like to start with a story that shows where we were before, I think, in education and where we are now, and what you helped to bring about as a result of your work. I always recall the child from rural North Carolina who was dropped in the King School over a weekend and left to go into the classroom, and he was scared to death. He was 8 years old. He kicked the teacher, and he ran out. And of course, that was the kind of kid who was going to be labeled bad and sent to the principal, punished, and go round and round, and eventually go on a downhill course because nobody responded to what was really going on. And in talking with the teachers and administrators about what was going on here, we talked about the fact that he was anxious and needed support. And the response of the school was to punish him for his bad behavior. So we thought about that, and after talking about it, I said, half kidding, there is an example of fight and flight. But everybody looked at me with a blank face. and nobody had heard of fight or flight. And that's when I realized that education as a discipline, as an enterprise, working with children, had ignored the children. How could you have a discipline? How could you have an enterprise that was supposed to help children grow and function and not know about children? And it was that moment that I realized there's the problem in education, and that's where we have to focus. Not only learning about that child, but helping all the people working with that child learn and understand what children are like.
Yes.
And that a good part of what we do as teachers, a good part of what we do as parents, a good part of what we do as community leaders, policymakers, is to understand what children are like and develop ways to help them grow and learn to manage, gain the capacities to manage themselves, and we will reduce many of the problems we have in the society, in schools, but in behavior of all kinds for all children. It's not limited to poor children, it's not limited to black children, it's not limited to any group. It's all children have the same fundamental needs. And that's what we as a society have to create. And the school is a place where you have the best chance to do it. You have the first chance to do it when it doesn't happen in community networks.
Thank you very much, Dr. Comer. Now, Dr. Comer, you began your work in 1968 in New Haven. Mm-hmm. And most people, when they think of those early days, think of Martin Luther King School and Catherine Brennan School. Can you tell us what it was like for you in those early days to begin this process? You know, in business, people talk about the proof of concept, you know. In education, we talk about piloting a program. So you were, in effect, piloting your program and at the same time developing proof of concept, mm-hmm. because you had an amazing concept. Mm-hmm. Can you talk about those early days for us?
Oh. It was an amazing concept, except that I didn't know what I was doing. Because I was from a medical background, and as close as I had gotten to schools was child development and children. And I didn't know anything about schools. And we decided that, with Dr. Al Sullivan, who was the chair of the department, who asked me to come back. I did my residency at Child Study Center, who asked me to come back to direct this program, but I didn't know education. I knew children, something about children. So we decided on a plan to live in schools, learn about schools, and then figure out with the people who were there how we could change them to make them better meet the needs of children. And it was that attitude and way of working that allowed us to realize that it's all about relationships, and that it's about relationships first, and that because all the other things you want to do can't be done or can't be done well until you have reasonably good relationships. Reasonably good relationships among the adults and the students, and that the interactions in the school then supported the kind of focus, the kind of attachment, the kind of connections that were needed to promote learning. Now, at the time we were learning that, we still, as a society, as scientific disciplines, still didn't understand that the brain grows as a result of the interactions between people, between children, the child, and people. We didn't understand that. The only way I knew that was important was because I used my own family background to raise the question of why is it me, my brothers and sisters did well in school and had a chance to do well in life when people who were just as smart as us were going on downhill course and in life and in school, and realized that the reason was that we had a very rich, warm, supportive, guiding family home experience. And so I knew that had something to do with it. And that's what I raised the question while I was still in School of Public Health at the University of Michigan. I did an article suggesting that the school should be able to provide or approximate that experience that I had at home in school. And so that the idea that you had to change the environment of the school so that it supported development came to me from that thought. And that's how the concept grew. Yeah. And it was a concept that wasn't there when I started. It grew, and we then eventually did that in the ways that we created structures that dealt with the basic needs of the adults, of the institutions, and eventually the guidelines that became the culture of the school. And it all emerged. It wasn't something that popped off my head.
Yes, yes.
It emerged.
Yes, yeah. Well, and I would probably assert also that Maggie's dream perhaps was sort of the inspiration that allowed you to think about how to, and her example, and your that example, to think about how to create that environment for kids. So we can see the connection between Maggie's American Dream and your work, right? And those ideas that you articulated in that wonderful book. Right. Yeah. So Dr. Comer, so then as you attempted to create this environment, culture and climate for children in schools, based on your own upbringing and the lessons you learned, we know that you had this 3x3x3 design, right? 3 guiding principles, 3 mechanisms, and 3 operations. But undergirding that 3x3, what I may call transactional process, you introduced a transformational idea of child development, and you used the developmental pathways to transform thinking about education and how education is connected to how children develop. And that's very transformational. That's not the way education was thought of back then, and sometimes even today, it is still not. So can you speak to those developmental pathways and the importance of those pathways in today's educational process?
Well, all children have to grow, and all have to grow along the developmental pathway. There are many pathways, but we decided in thinking about it that there were at least 6, and we developed those pathways. But I think the important part, and the point I want to make, is that those pathways can support development best when they grow out of a school-based or organization-based group of structures that allow all of the adults to get along well. And when they get along reasonably well, they are then able to respond to, they are available for the first part of growth along the pathway. And the first part of growth along the pathway requires a connection between the child and the adults and the other children in his or her environment. And that without that connection, it makes it much more difficult. And so that connection has to be created by the conditions that are created by the by the governance and management team, and by the parents team, and by the SBMTs, school the support staff team. All of those teams support and meet the needs of the adults, and in so doing, you create a culture in the school, and particularly the guidelines help to create. When we all work through those guidelines, you then create the culture. It is that culture, in that culture, that the children begin to grow. But then the adults have to be able to connect and guide and help the children grow along the pathways that are going to make them successful in life. And of course, the physical, the social, my favorite pathways is social and emotional, and the mastery, where the executive functioning takes place, and the cognitive, and the bringing all of the pathways together so that they all act together to promote the kind of executive functioning that enables the child to be successful. And I'm going to say this again, as I looked at the board in the video you're going to see, I saw them all coming together to make it possible for children to be successful. If we did that for every child in the country, every place, we could reduce many of the social problems that we have in the society. But we don't do it, you know. And I'll probably repeat this, but it struck me so as I was making that video. I looked at one of the blackboards that had one of the classrooms, growth along the pathways, and the teacher had acceptable behavior and unacceptable behavior. And in first grade, one of the things that was under unacceptable behavior was, in essence, it said, keep your hands to yourself. And I thought to myself, what a remarkable statement, and that we should start teaching children from first grade forward, given what's going on in the country today and the Me Too movement and the like. that had all of those people being caught up, started back in first grade, learning to keep their hands to themselves, we'd be much better off.
Well, you know, Dr. Comas, you mentioned the sort of implacable connection between the emotional and the cognitive aspects of who we are and who children are, and the brain connections, you know, the emotional brain and the academic cognitive brain. So you, in 1968, you actually were talking about social and emotional development and social and emotional learning, or at least laying the foundation for that.
We were, before there was a movement, we were talking about social emotional development because it was related to my own personal experience. I knew that was important. You know, the actual brain work that we're now talking about, it's only 30 years old, 30, 40 years old. And so we were doing it before the actual biological discovery of the connection and the importance and of the way the brain developed. And that grew out of lived experience. And that's why paying attention to lived experience is so important. That's truth. Lived experience is truth. And you have to observe it and use it and understand it. And that's what we did, was to not accept. There was something wrong with schools when I went in, something wrong, because there were bright kids who weren't performing well. And so what was wrong with it was that they weren't paying attention. The focus was on curriculum, instruction, and assessment. And all the kids who were not prepared to perform at the level of the curriculum, instruction, assessment expectations were considered not as good, not as bad, not as good, and not as smart.
Yes.
And began to have failure experiences as a result of the expectations and the responses they were receiving. When you flip it and child development and being able to function well becomes important,
Yes.
then children who are underdeveloped, differently developed, gain recognition, approval from gaining the capacity to function well. And that's the part of it that's so important, because once you gain capacity to function well and you function well, you begin to receive good feedback about yourself and go forward. And the grading doesn't get in the way, and the grading on the academic part of it. And the academic performance will come as the child develops, and that is what happened with our work.
Yes, absolutely, absolutely. And you definitely were talking about positive behavior intervention and supports back then. You were talking about response to intervention. You were talking about a lot of things that is currency in today's educational environment.
And yet what does bother me is that we still think about those things isolated, as if they're not all a part of the experience of a child.
Absolutely, yes, yes. Dr. Kumar, I'd like to talk a bit about the scaling up process. So you embarked on this proof of concept, if I am permitted to borrow from the business field. You had a pilot in New Haven, and then you expanded within New Haven and brought people in from around the country. And then at some point, it was time to scale up. And scaling up to school districts, not just schools, but also working with entire districts. Can you share with us your reflections on the desire and plan to scale up and how that went, and what were some of the challenges and benefits of doing that?
Yeah. Well, the model was successfully scaled up in many places. 2/3 of the time, there was great improvement. A third of the time, there was less than great improvement or no improvement. And what was clear is that where people buy in and understand, you get improvement. And can you hear? How many minutes?
You would like for me to tell you for real?
Yeah.
So may I just say, I apologize. When I was up there earlier, what I should have said to you guys is that as SDP family members, you do remember the assessment and modification of SDP. So one of our operations that worked so well. And so we had to modify to give you extra time for brunch. So what you have on the table, the agenda you have on the table, we expanded the time for lunch, so by 15 minutes. So we started this section 15 minutes later. So it shows that we're stopping this at 12 o'clock, but we're going on until 12:15. So I wanted to say that to you. So that's it. So Dr. Haynes, you have 15 minutes, but also including audience
Okay,
questions.
sure,
So
all
maybe
right.
a couple more minutes of this,
Okay.
and 10 minutes for audience
Okay,
questions.
Okay.
very good.
Thank you.
All right.
Thank
okay.
you.
All right.
Let me say very quickly then, what we found is that when you had, what we found was that if you didn't have someone from the local community as the facilitator, as the leader of the program, that it wouldn't work. Because the whole idea is that it has to be owned. It has to be yours. It doesn't come in from somebody on the outside, it has to be yours. And so we found people with a track record for leadership and who understood the concepts, and they became the facilitators locally. And that's why many of you in this room played that role, and we couldn't have been successful without it. It was a very important role. And so there was a connection between school development program central and school development program at the site that allowed to transmit the concepts and for people to play them out and act them out and develop them to meet local needs. One of the things I've always loved is that you could go to schools and each school had the same basic principles, but they all looked different. And that's because they were shaped by the people there to meet their own needs. And that was the idea we took. And we were beginning to work for, I think it was in 2000, there were about almost 2,000 people a year being trained in this method. And then No Child Left Behind came along. No Child Left Behind was a political victory, and No Child Left Behind wiped us out. And I remember saying to people, just hang on to the principles that no child left behind will die, and the important thing is to still be standing when no child left behind dies. And it did die. And we are now having the rebirth in the Aspen and others, but the one I'm involved with is the Aspen National Commission Social Emotional Academic Development, and I'm honorary chair of that group. And we want to carry on the principles that got started with your work into a national movement that eventually changes the way we do education in this country. And so that teachers in the future will be people who have, from the beginning of their careers, been introduced to child development and have child development principles, ideas, attitudes that get automatically integrated. And that's the only way, in my opinion, you can scale up. You can't scale up by taking somebody in to teach and they go. Somebody called that the drive-by teaching. It has to come from within. It has to come from people who live the concept and who can transmit it because they live it. And it has to be negotiated. Every day we're negotiating the concepts. You know?
Yes.
The no-fault concept, as somebody said, was their favorite. That's because we do it all the time. We have to live with it all the time. No fault's difficult because we want to blame somebody. And so it has to be negotiated every day, and we're always working. And it is scale up, but it's scale up through the carriers of the principle, and those are the people who believe in, buy into the principles every day, and then live it.
Thank you. Thank you. And it's an SDP skill to be able to say wrap it up and say it as nicely as as Dr. Brown did. So we're going to wrap it up. And in wrapping up, Dr. Combs, I'd just like to ask you one other question. Beyond the so after you scaled up, and even during the time you were scaling up, you established some very important relationships, other kinds of partnerships, school-university partnerships, as well as partnerships with other organizations or other programs, like COSI, for example, the Comer-Ziegler program, the Atlas program, Authentic Teaching, Learning, and Assessment for all students, learning for all students, which was the Ted Sizer and Howard Gardner partnership with SDP and Janet Whitler at EDC. So can you tell us what these partnerships have meant, the university partnerships as well as those other partnerships with
Yeah.
Edward Ziegler and Howard Gardner and those other folks.
Yeah. What I knew was that you couldn't simply go from place to place to place and teach. And you couldn't, as an outsider, teach other people. I remember going to university once because I had been invited by one part of the faculty to try to convince the other part of the faculty that we should start thinking child development. Well, as it turns out, the part that they wanted to convince, they boycotted the session. So that it didn't get to them anyway. You can't do it that way. You can't just teach. You have to create structures and experiences, and you have to have multiple carriers in many forms. And so the different kinds of programs that you cited, all were carrying the same message underneath. They were just working differently, composed differently. And that's the way things are going to go, and will have to go, to change the way we do education for all children in this country. I was listening to my grandson's description of his school that he likes very much, and it is the school of the future, where kids have experiences that excite them. And at the same time, they're gaining the basic knowledge and information, and they're better able to gain it because they're happy about going to school. They're excited about being at school. And but that takes time to create. And it needs a school workforce. It needs social policy at every level, at the district level, at the city level, at the state level, at the national level. All of that has to change, because in education, in America, education meant pouring information into the minds of kids, and that was it. And they were supposed to give it back to you on tests. That was American education. And it survived right down, and still survives in many places in this country. That we have to change and establish that the most important thing is to support the development of kids, and when kids are developing well, they will learn. They will learn academic material, they will learn social relationships, and how to relate, and how to elicit positive responses from others and their environment. And when they're able to do that, they're more likely to be successful. And also, and importantly, and the message that the conservatives have to get, is that they'll be better citizens. So that's what we're about. Thank you.
Thank you.
Thank you.
We'll take a question from the audience.
Dr. Comer, I'm wondering, in the spirit of scaling the program almost globally, I remember doing some work with you in Puerto Rico. I wonder how that's going. I know you did some work in Scandinavia. How well does this process translate across language, culture, those kinds of things?
Well, it always translates. It's just sustaining it that is the problem. It's sustaining it everywhere, because the systematic efforts to put in place the structures, the organizations that can help you smoothly move as your basic program demands are not there. And in some places, you're up against greater resistance than in others, but still, almost very few places is there structure. And in part, it's very difficult because every place is changing politically, economically, and so on. But the idea that you got to protect education needs to be established, and still has to be established. And there are places that protect education better than we do. But that's where we have to go, because we have now established very well, with a biological basis of understanding, that education is an interactive process, and brain development is an interactive process, and that it has to be protected. That process that allows that to happen has to be protected. But it's hard because it's not, education isn't as simple, and it isn't a simple, isolated matter related to the brain. It's a complex issue that is political, economic, social, and all of those things interacting together.
Thank you very much, Dr. Comer.